This is Sally Schessler, the Director of Education for Allergy and Asthma Network, and I am pleased to host today's webinar for the Allergy and Asthma Network. Our mission is to end the needless death and suffering due to asthma, allergies, and related conditions through outreach, education, advocacy, and research. We welcome you to our August webinar in our webinar series titled Advances in Allergy and Asthma. Today, we're pleased to be joined by Dr. Todd Mahr, who's going to be speaking on vaping, what we need to know. There's so much in the news about vaping. Is it more dangerous than smoking? Is it better than smoking? How is vaping affecting the respiratory health of our youth? Dr. Mahr will answer these questions and more in tonight's webinar. Todd Mahr, MD, is Director of Pediatric Allergy and Immunology at Gunderson Health Systems in La Crosse, Wisconsin. He is also an adjunct clinical professor of pediatrics at the University of Wisconsin School of Medicine and Public Health in Madison, Wisconsin. Dr. Mahr belongs to numerous allergy societies, served on the Board of Regents of the American College of Allergy, Asthma and Immunology, and has received their Distinguished Service Award in 2008 and Distinguished Fellow Award in 2014. He is currently president of the college. He is current chair of the Partnership for a Tobacco-Free Wisconsin, and he is chair emeritus of the Centers for Disease Control and Prevention funded Wisconsin Asthma Coalition. He is very active with the American Lung Association on a national, regional, and local level. He is the recipient of the ALA's Volunteer of the Year Award for 2000 and the 2007 Wisconsin Department of Health and Family Services Partner in Public Health Certificate of Recognition. Dr. Mahr is also very engaged with the American Academy of Pediatrics and received the Jerome Glaser Distinguished Service Award in 2017. Dr. Mahr, we're so pleased that you could take time in your busy schedule to be with us today, and we look forward to the information that you have to share with us.
Thank you, Sally, and I want to thank everybody else for being online also, and hopefully you're going to learn a lot tonight, and we'll have some interaction as we get through tonight's program. As Sally mentioned, I mean, vaping is in the news almost every night now, for sure. And this was something from NBC, basically back in July, talking about an athlete who basically came forward and basically said, you know, vaping actually hurt my career. The moment I started using nicotine through e-cigarettes, I turned off my future goals completely. Basically, when he started as in middle school, using e-cigarettes, he basically got addicted. He increased his use to a point where it left him struggling to breathe, kept him off the ice, and actually kept him from the career that most thought he was going to be able to have. Here's what we're hearing about now in the news. This came to us here in the state of Wisconsin just a few weeks ago. About severe pulmonary disease among adolescents. Now tonight's news, we're over 150 cases in 16 states now is what they're talking about. In Wisconsin, we've had at least 25 cases or more. They don't know what's going on. It's scary that all these youth and young adults are vaping and dabbing, which is vaping of marijuana oils or extracts or concentrates, and we'll talk about that a little bit. But they have chest pain, fatigue, cough. Some have had chest tubes, and some have been left with some permanent damage, they think. It's early in all of this issues that are going on. We don't know exactly what's going on. The CDC is actively looking into this and trying to figure this out. So the dilemma is the fact that we're seeing also some Juul alikes, I think, out there as part of it. This was also last week in the New York Times, how basically on the left of this picture, you can see basically what a Juul package looks like. And here's a knockoff Eon Smokes Juul compatible flavored nicotine pods. And they're offering strawberry milk, peach madness, whoopie, which tastes like Fruit Loops, I guess. And they're having a great year, so to speak. And Juul is under pressure to remove all of their fruity or candy flavored pods, but these Juul alikes are complicating everything. They're complicating Juul's effort to clean things up, supposedly. And basically, the question is, are some of these lookalikes that are out there with no regulation whatsoever, part of the problem that we're seeing right now. We just don't know. So let's back way up, so way back, and talk about cigarettes just really briefly. So all this started basically with nicotine. So basically, here's a photo basically from the 19th century, bottom right, looking at Egyptian cigarettes, and you can see a carving here of a Mayan priest smoking from a smoking tube. So we've had cigarettes around for quite some time. And the tobacco industry basically did okay, but in about 1881, really took off, and that was after John Bonsack invented the cigarette making machine. And after that, then cigarette smoking became widespread. And on the graph on the right, you can see basically is just a couple decades plus going back of looking at what's happened with annual per capita cigarette smoking in the United States. And you can see World War II had spiked up quite a bit. There was a little dip after the first smoking cancer concern, but it wasn't until we had the Surgeon General's report and the World Conference on Smoking Health, the ban on advertising, and a few of those things that started making that trend change in the 70s, basically. And you can see a downward trend from there on. Now, those of you are old enough to remember, basically Big Tobacco was Big Tobacco. And Big Tobacco had quite a big, huge influence on a lot. And once cigarettes really became easier to make, tobacco companies developed and expanded this market. And they used lots of advertising strategies, and they were quite glamorous from that standpoint, and used us in the healthcare field to a great degree. You know, basically you can see that doctors are making strong claims about the lack of risk associated with cigarettes. Even on the right-hand side, 20,679 physicians say Luckies are less irritating. It's toasted. So basically, the ads were meant to be believable. There were a lot of physicians who were smoking, unfortunately. And here's Camels, and it's another picture. Every doctor in private practice was asked, what cigarette do you smoke? And more of them answered Camels than any other cigarette. The T-zone was basically this zone that you, for taste, that they promoted, that they tasted the best. Viceroys basically pulled in dentists and claimed after prescribing Philip Morris brand cigarettes, they had less irritated throats, and their throat irritation completely cleared. And they didn't leave kids out. And a number of us remember these. That I can remember the Fred Flintstone ones being on TV. And basically, these are based some correspondence that was found in some of the tobacco industry data that was pulled. Today's teenagers, tomorrow's potential regular customer. And the overwhelming majority of smokers first begin to smoke while they're in their teens. The base of our business is the high school student. These are old quotes, but I don't think that they're basically not quotes that we couldn't find maybe in some of the e-cigarette and vaping industry, which is now owned by a lot of the big tobacco. So you look at these ads, you look at the ones I just showed you, and then we move into now. And these are the ads you're seeing for a variety of e-cigarettes. They make them look quite sexy, quite appealing. They've pulled a lot from the old ad techniques, and basically make them look like, you know, smoking without the side effects, no burning, no tar, no cancerous substances, no ashtrays, no horrible smells. Smokes like a cigarette, feels like a cigarette, tastes amazing. So that's what we're fighting. And then the peer-to-peer pressure. Now, is it really a problem? Yes, indeed it is. I mean, this is basically from the statistics up through 2018, looking at in gray, light gray, the 8th graders, 10th graders in the kind of the bluish gray, and then 12th graders in red. And we can see whether they were a lifetime smoker or the past year or just the past month. So 37% of 12th graders said that they'd done the same. They had an increase in their vaping from 27.8% in 2017, so that they had vaped in the past year. More frequent use teenagers nearly doubled, okay? And overall cigarette use is down, and we can congratulate ourselves on that, but e-cigarettes are up. All right, and that's what's got everybody worried. And now we've got this huge issue going on with the lung damage that's occurring. So this was from a study that came out in British Medical Journal just this past year, and it really talked about vaping in adolescents and what was known. They looked at Canada, England, and the U.S., and they looked at some of these new devices, which were Juul at the time, which use a nicotine salt, and we'll talk about that in a little bit, but it delivers much more nicotine. Canada had a more permissive regulatory framework than Europe did, and what they found were a little bit of differences. And what the findings overall was that vaping in the U.S. and Canada increased, and with basically fewer changes in the adolescents in England, partially because of the marketing restrictions that they had and the maximum nicotine levels under the European Tobacco Product Directive, which was great. So overall, vaping among young people are changing, and Juul is changing this completely. So what are nicotine delivery systems or electronic nicotine delivery systems? So you might hear them called ENDS. A lot of people refer them to electronic cigarettes. So what is it? So basically, it's a smokeless battery-operated device. It delivers nicotine with flavorings or other chemicals to the lungs. A vape pen is a handheld device used to generate inhalable vapor, they call it, but it's not. We'll talk about that. They can vape anything. These devices can vaporize any liquid. So one of the issues is definitely they've been shown to be used to vape THC, the active component in marijuana. So all of them can do that. There's lots of choices. Most of the devices resemble cigarettes. That's what they first came out. They were when they first came out, they were basically meant to supposedly get people to quit smoking. All right, and so they made them look like a cigarette. And then as you saw more and more competition and more people jumped on this, you saw more businesses open, realizing that, hey, the youth are the market here, and they don't really care if they look like a cigarette. In fact, they don't want them to look like a cigarette. So hookah tips, screwdrivers, memory sticks. The liquid that's contained in the e-cigarette is often referred to as juice or e-liquid. It contains nicotine for sure in the majority of them. Some supposedly don't. There's actually been studies now showing that even some that say they do contain it because it's unregulated. There's water, there's propylene glycol, glycerins, and other flavorings. Okay, they can be prepackaged in cartridges that are basically non-refillable. Some are refillable. And the vaping is that inhalation, exhalation of that nicotine vapor. So what's an e-cigarette? So here's a little diagram of it. Basically, there's a battery. There's an atomizer coil that basically is in contact with some type of an absorbent material that the e-juice kind of feeds into. And again, that contains all the nicotine and the other things that we talked about. And then you get basically nicotine aerosol afterwards. So is secondhand smoke a problem? Well, yes, it can be too, because it contains all of this. So basically, the original e-cigarettes, again, look like a cigarette, came preloaded and were disposable, and things have changed. This is just a picture showing you all, a snapshot of available e-cigarettes and vaping pens and lots of other juices that are out there. There's mods, there's pods, there's e-cigarettes, there's vape pens, and then there's the Juul devices, and there's a variety of other ones. So one thing we need to talk about and you need to understand is what youth think is that this is a vapor. It's called vaping, so it's a vapor. And really a vapor means the same as a gas, which is an indefinite expansion of basically a gas out of a bottle. It's going to spread and it's going to mix with the air. Okay, it's not as precise a term as gas or aerosol. An aerosol is really a mixture of liquid particles suspended in a gas. So instead of just mixing with air like pure gas, aerosols can leave droplets behind. And the big key to get across to the youth is that it is an aerosol. It is not a vapor, okay? And so they think they're inhaling this basically vapor of moisture, and they're inhaling fine particles, and they're inhaling an aerosol. So is it better than a cigarette? Okay, and we hear that all the time. So combustible cigarette smoke, there's about 70 carcinogens. There's formaldehyde, free radicals, toxic gases, heavy metals, benzenes, a variety of things out there. And you can measure these levels of toxins are 9-fold to 450-fold greater than in e-cigarettes vapor, okay? And in e-cigarette, the aerosol from that has been found to have some particulate matter emissions that are about 15 times less than that from combustible cigarettes in one study. They exceed what the World Health Organization would clarify as good air quality, though. You need to know that. But what can be in them? So what can be in them is a variety of things. So all of these things have been linked and found to become e-salt. So a variety of things, most of them nicotine, but acetaldehyde, formaldehyde, etc. Now, if we look at it, some of these have basically actually been found to be harmful or potentially harmful substances in yellow here. So definitely nicotine, but xylene, toluene, aldehyde, formaldehyde, naphthalene. There's nickel and some heavy metals in some of these, lead, cadmium, and cobalt. So no, these aren't safe. And what are some of these things used for? Propylene glycol is an antifreeze. Acetone's a nail polish remover. Ethylene benzene, they're in paints and pesticides. Formaldehyde's in embalming fluid. We know what nicotine is. Rubidium is in fireworks. So getting that information across to youth is one of the other things I think it's important for us to do as healthcare providers. So let's back up again and say, what is nicotine? Well, they have to understand that these are not, again, just water vapor type of products. They deliver nicotine. And some of the newer ones deliver nicotine very, very potently and very effectively. And nicotine is a drug. It's a stimulant. It is highly addictive and causes changes in the brain chemistry and is found in tobacco products. So what happens with addiction with this? So this shows someone inhaling off the blue e-cigarette. And what you see is a cycle of nicotine addiction starts. It brings nicotine into the body through either e-cigarettes, hookahs, or plain cigarettes. It enters the brain, activates the pleasure centers, okay? And some people say, well, you shouldn't talk to them about this, that you don't want to tell them it's pleasurable. No, this is what they're figuring out, that when they inhale, they get some pleasure out of it, okay? And after a while, however, the level of nicotine in the body drops, and basically then they want more of that. And so they will inhale more. Okay, and that's how cigarettes have done this over decades and everything. The drop in nicotine causes the body to have strong cravings for more nicotine, and the set point for that pleasure center actually increases. So they have to actually, over time, inhale more nicotine to get that same degree of pleasure, so to speak. And that's the vicious cycle that we've seen with cigarettes and is unfortunately so rampant with the e-cigarettes now because of the amount of nicotine that they can deliver. Now, they will say, well, we're e-cigarettes. We're not marketing to youth. And my question would be, why do you have all of these flavors if you're not marketing it to youth? I don't know many adults who really want, necessarily caramel frappe or banana or almond or peach or the tutti fruttis and all of these other flavors. And now we're seeing some data that recently has come out showing some of these flavors themselves have cytotoxic effects. We know cinnamon does. Cherry flavors has benzoyl in it. And so all of these flavors, which are really used to capture the youth because they prefer these fruit and the kind of modified alcohol type flavors, creme brulee and other things. Adults like tobacco and menthol and mint and coffee and spices. So more flavors, more use in adolescence, right? And that was the trend that was moving forward in e-cigarettes and vaping until this bad guy came along. And this is Juul, right? This is what it looks like, right? And Juul was a game changer. The primary feature of Juul e-cigarette is its patented formula of nicotine. So it changed the game by doing a chemically modified form called free-base nicotine is what basically other brands used. Juul used nicotine salts. So it wasn't this free-base nicotine, it was truly a nicotine salt. And this more closely resembled the natural structure of nicotine and makes nicotine more readily absorbed into the bloodstream and made the vapor a little less harsh so that it's a little easier to inhale more nicotine for longer periods of time. All right, since launching, Juul's become the hottest e-cigarette on the market. It's kind of the iPhone of e-cigarettes, and it's a portable nicotine delivery device. Now, the ads, it's amazing. We just saw one last night on TV for Juul. And I mean, obviously the TV ads now are geared for that. It's an adult product, and they're really pushing because they've been called before Congress, and they've been, you know, basically read the Riot Act, so to speak. One of the issues is Juul pods contain greater amount of benzoic acid, also 4.8 milligrams per ml compared to other e-cigarettes brand. Benzoic acid is known to cause coughing, sore throats, abdominal pain, nausea, and vomiting if exposure is constant, which occurs with Juul. And so this basically is done because of how Juuls utilize the properties of this, unfortunately. So that's leading to these kids overwhelmingly taking too much, inhaling too much, and ending up in the ER. So again, it's got two components to it. The bottom part's a device, and it has a battery, just like we just went through. It has a temperature regulation system, so it doesn't overheat. And the top part is this e-liquid cartridge that you stick into the device. I'll show you pictures here in a minute. The cartridge is also the mouthpiece, so you just click it into the Juul, and you're ready to go. It's rechargeable, comes with a USB charger, and you can pop it into your laptop or charging block. So this is how it kind of looks. Upper left is kind of basically you get a USB type plug-in charger, and then that's a pod there. The bottom left is basically what you can plug into a USB port on your laptop, and I'll show you in a minute, and it makes it really look like almost an antenna. This is one of the kits you could get with 4 different flavors, and they were not refillable. However, when I started looking into this, it was very easy to find on YouTube 4 or 5 videos that show you exactly how to crack this system and to refill these. And so the youth are definitely knowing well ahead of us what to do. Here's actually what it looks like when it's plugged in. I mean, if I'd seen that, I would think that's an antenna. And somebody's got an antenna on their laptop. So when it's plugged in like that, that's charging, okay? Reaches a full charge in an hour. You starting with your Juul pod, they say remove the colored cap, insert the cartridge into your device. Viola becomes your mouthpiece, and as well as the flavorful engine that powers Juul. No buttons, no switches, just draw. I mean, suck on it basically and get it going. Careful at first because it might be strong to first timers. And then it's got this light that you can see down below. It turns green, and it basically glows during to reflect your pull strength. So basically, it can also show your charge level, high, medium, and low, and pull strength. So it does dual purpose. All right, so this was from JAMA Open, published this past year. 445 high school students whose average age was about 19. They observed teens who used Juul tended to say they vaped more frequently than those who used other devices. Juul users also appeared to be less aware of how addictive devices could be compared with teens who vaped other e-cigarettes. And so basically one of the authors said that she was surprised how often the youth were using these Juuls, okay? It's not a combustible cigarette, but it still contains an enormous amount of nicotine, at least as much as a pack of cigarettes. So where's the disconnect? Where are we having problems, you know, with the youth? Well, the fact is they're not getting the fact that nicotine, and nicotine is nicotine. And again, nicotine's highly addictive substance. With each hit of a Juul pack, it is a huge amount of nicotine. It's 0.7 mLs per pod, which is the equivalent of a pack of cigarettes, about 200 puffs. The e-liquid in Juul is 5% nicotine by volume, which is more than twice the concentration of similar devices like the blue e-cigarette. So that increases the risk of addiction right there, all right? Juul also produces minimal byproducts, so you don't blow out an obnoxious cloud of smelly smoke or vapor. And this makes it a lot easier to use inside. And that's what our teachers are finding out, that these devices are easy to hide. They're small. They don't look like a cigarette. They're not these big mods that are really large containers. They're very simple. They'll pull on them. They'll take a draw on them, and they'll actually blow out into their sleeve or their clothes. And so they're using them without basically people knowing it. I was in a clinic today in Iowa area, and we were talking to some parents, and I obviously talked to all the kids I see about vaping and using e-cigarettes. And, you know, the one student said, yeah, actually the locker rooms had to be locked during the day last year because they were, the kids were getting into it just to go vaping so often. And so unfortunately, it's just rampant in schools. I'm not going to go into the side effects of nicotine. Most of you people know this, but basically it is an issue. So definitely bronchospasm in the lungs, but people will have a tremor. There's an increased risk of clotting. There's nausea, dry mouth, diarrhea. You can get lightheadedness, headache, dizziness, increased heart rate, etc. And these kids are coming into the ER with nicotine toxicity, right? And so that is a problem. But we deal with the fact that people relate it to cigarettes. So e-cigarettes do appear, when you look at it, to have less toxicants and carcinogens. But it's really dependent on the user, what liquid they're using, the device, and the usage overall. There is no long-term data. They've been out for a very short period of time from that standpoint, and we don't have decades of data to fall back on, okay? So it's an argument that some people will make, and I find it a little bit difficult. I know somebody else today was telling me that their son and daughter both are vaping now, and they've just said, you know, it's saving them a lot of money because it's less expensive than cigarettes. And that's one of the problems we're dealing with nationwide. So I think, you know, tobacco 21 laws are one of the things we need to do, and that includes e-cigarettes, so we can make it harder for them to buy it. And two, we got to get the message out there that, yeah, they might be cheaper, but we got to fix that. So increasing the tax on these to make them less affordable, like we did with cigarettes, is one of the things to think about. There's also no prospective studies examining the effects of e-cigarettes on airway physiology, patterns, or symptoms in patients with asthma. We do know some epidemiologic data coming out that asthmatics tend to use e-cigarettes more, I said more, than non-asthmatics. And I think it's because they think it's safe. They think it's an alternative. And e-cigarettes are not safe for asthmatics, but probably safer than combustible cigarettes. That's a difficult message to get across. So National Academies of Sciences, Engineering, Medicine concluded there was a moderate evidence for increased cough and wheeze in adolescents who use e-cigarettes and an association with e-cigarette use and an increase in asthma exacerbations. So are e-cigarettes really bad? Well, I mean, the main concern about e-cigarettes is that they may pose unforeseen health problems. And I think we're beginning to see that now. We're beginning to see that these are things that aren't necessarily the panacea of safety that a lot of youth have thought of. But I don't know if they're seeing these 150 plus cases as something to be worried about. I do, and I'm encouraging all parents to make their kids aware of this. So we have the individual vaping, but just like we did with cigarettes, we have secondhand and third-hand deleterious effects we have to think about. All right, e-cigarettes also, the liquids, all right, the juice, undergo chemical reactions that create potentially harmful compounds. So that's what's being researched a lot now in a number of areas, the changes that occur with heating these compounds. And we know that some of the juices, even without the nicotine, can have effect on the endothelial lining of our vessels and create problems. So we have to worry about that. And the big thing is, basically, there's stores that are making their own formulations. This is the wild, wild west. There's no control over any of it. And there are studies out there now and some reports of, you know, the juice being sold that supposedly has no nicotine at all, and they find nicotine in it. So, I mean, if we kind of look at it, all right, there's a good side. Now, I have it in quotes, and I have it green because I don't know, but I'm trying to give you all sides of this from that standpoint. All right, e-cigarette use might lead to some favorable alterations in smoking habits and increased smoking cessation rates. That's debatable, okay? This might be through mimicry of conventional smoking behaviors. There was one study done where they actually looked at patients who were, they split the patients, half of them did nicotine patch and replacement. The other half did e-cigarettes. They looked at them a year later. And yes, if you looked at the surface, there were less patients smoking on the e-cigarette side than on the other side. However, if you looked at them more closely, 85% of them were still using e-cigarettes. That's not necessarily good. And the measured levels of toxins in e-cigarette vapor are anywhere from 9 to 450-fold less than conventional cigarette smoke, and the particulate matter emissions are less, but it's still not safe. All right, and that's what we have to get across. Increased expired carbon monoxide levels are up in conventional cigarette users, but we don't see that to the same degree in e-cigarette users. And e-cigarette use decreased airway hyperresponsiveness and had little or no effects on pulmonary function in comparison to combustible cigarettes in mild to moderate asthmatics. I don't know if that's a fair comparison. But the evidence is now beginning to accumulate on the risks, especially in asthmatics. So, the bad side then, aerosols of e-cigarette liquids contain various toxic substances. And we'll get into that in a little bit here. So, toxic substances in low levels, but depending on the heating degree, depending on the draw, these toxic products can exceed the levels of a combustible cigarette. We have no idea what e-cigarettes have what kind of effect they have on the fetus during pregnancy. It's just not been out enough. There is concerns over suicidal and accidental poisonings due to these e-cigarette liquids. And again, what's changing is these devices are what's changing. So we're seeing more and more novel devices that are getting away from, quote, the true cigarette. So one of the things that's been talked about is popcorn lung. So a popcorn lung is described as popcorn lung because it basically is caused by diacetyl, and it's this is constrictive bronchiolitis obliterans, basically. And this was named after factory workers who were inhaling this artificial butter flavor while working in microwave popcorn factories. And it caused their small airways of the lungs to become irreversibly scarred and constricted, impairing breathing, and kind of this shows popcorn in the lung, but it basically was these alveoli and bronchioles and what we would now call bronchiolitis obliterans. So something definitely to make youth aware of, and that's diacetyl, and it's in e-liquid juice. What about oral health? I mean, this is borrowed from the American Lung Association, but here's vaping and oral health. This is basically the teeth after effects of e-cigarette usage. So again, it's heated vapor, contains a number of toxins, and I could leave that up and all of you would lose your dinner, so I'm going to take it down. But burns have been described too. And so this is scary. These are the exploding e-cigarettes. Now on the upper right, you see those are not, those are basically some homemade and packaged type e-cigarette devices. And those are the ones you have to worry about because people are putting these together to even save more money. These batteries are horrible. The upper right, a man lost his eye after e-cigarette explosion. Upper left, you see horrible burns from one that exploded in his pants on the bottom left and a face of a teen. And so basically, you have to be a little careful with these. There can definitely be some downsides to an exploding thing. Now, definitely e-cigarette use and marijuana use is increasing too. And this was something that was just published a couple weeks ago in the JAMA Pediatrics on Online First, and it was a meta-analysis that looked at a significant increase in the odds of past or current and subsequent marijuana use in adolescents and young adults who used e-cigarettes. So we talk about gateway drugs, but they just getting them in the mindset of this is something I can do and it's safe leads to this slippery slope. So it highlights the importance of addressing the rapid increases in e-cigarette use among youth as a mean to help limit the marijuana use in this population. And again, as marijuana is becoming more acceptable, this isn't necessarily the best means to inhale it to because that's not what had been done in the past. So I think it opens a whole bunch of problematic areas for us to think about. All right. And with that, then, we can do some stuff, okay? So we basically, this is an article that came out in Annals now a couple years ago about counseling patients with asthma and allergy about electronic cigarettes. So I know there's information out there for you to actually look at and use. I'm not going to play these now, but I'm going to leave it up there for a minute for you. This is a great resource. These are the de novo files, okay? And Dr. de Noble's story will actually just amaze you. He was hired by Philip Morris in the 1980s to develop a safer cigarette. And basically, he looked into the addictive part of it and didn't like what he saw, and then was basically fired and basically worked to help undermine the tobacco industry, so to speak. So these some funds were set up with some of the settlement money, and these were set up by the Arizona Department of Health Services. And so they're on YouTube. As you can see, they're all about 1 minute to 2 minutes in length. They're all geared, you can see like the upper left, they're all cartoonish, and they're geared towards educating youth about cigarettes, smoking, and now e-cigarettes. And you know, the one talks about how the brain loves nicotine. You can see the hat flipping up, and there's the brain, and pretty soon it'll show the brain actually inhaling directly from the e-cigarette. And it talks about the fact that, you know, are e-cigarettes safer? Well, yes, it's safer to jump from a 10-story building than a 100-story building, but the outcome's really about the same, all right? And so you need to know that. So again, to have something in your toolbox to use while you're trying to educate people and youth, think about these and look at these yourself, and they're in the public domain, and you could use those. Another one is Vape Talk. And so Vape Talk is from the American Lung Association. They brought out this program called Vape Talk, and these are all short little clips that basically encourage kids to, encouraging parents to actually talk to their kids. One is about a party, and another one's about Billy. And it's a youth basically saying, hey, you might want to talk to me about e-cigarettes because I'm going to a party tonight and I'm going to try e-cigarettes. And I really wish you would have talked to me about beforehand. So something you can look at and can do. Turn to your societies. This is the American Academy of Pediatrics with Sally told you I've done quite a bit with them, and they've got the Julius B. Richmond Center for Excellence. And this mission is to improve child health by eliminating children's exposure to tobacco and secondhand smoke. It was funded basically by the Flight Attendant Medical Research Institute, which came out of the settlement from smoking in airplanes. But they've got some very good ones. You can see here, there's some e-cigarettes, how they compare to a cigarette at the top, and in the middle is like a mod and then a Juul, okay? And there's a new one out called Soren, which is actually more of a big pod. I don't have the picture in here, and that actually contains the equivalent of 99 cigarettes in e-juice and nicotine. So unfortunately, we're seeing more and more of this occurring, and it leads to as many questions, if you would consider, than answers, unfortunately. But what I wanted this to be is to give you an overview tonight about the whole class, what you need to get your hands wrapped around so that you know a little bit more. Dabbing is new terminology, and that's out there for using THC and other illicit things in your e-cigarettes. So we're beyond being able to ask kids that we see with asthma, are you smoking? You know, are you smoking anything? Unless you get direct with them, and now it's, are you doing e-cigarettes? Are you juuling? Are you dabbing? Are you inhaling anything in your lungs? Is a good way of basically asking those questions. So with that, I tried to end a little time so we could have some questions and I can make up some answers. So Sally?
Oh, this has been just fascinating. I'm so glad that you spoke to everybody about this tonight. I'm thinking as parents need this information, but also practitioners as well. But it is a scary and slippery slope, it seems. So we have some questions, and some people wrote in early in the program. So you may have already answered some of these, but I still want to put it out there because some things also do bear repeating. So our first question is, does clinical presentation or lab findings or pathology suggest whether acute respiratory distress disorder is seen as toxic, infectious, or immunological? So basically, can you tell on an exam, what the cause of, is it an e-cigarette type thing, or is it something else? And they did ask also if asthma or other conditions act as a risk factor.
Well, I mean, the answer would be yes. Asthma and other respiratory conditions are definitely a risk factor. And what the CDC is struggling with right now is they definitely know that this outbreak that we're seeing, if you want to call it an outbreak, is not infectious. Okay, is there something different immunologically? They don't know. They're doing some research now, but I think what they're suspicious of is a couple of things. One is the devices are changing. We're seeing more nicotine, and now we're beginning to see more home brewed use. So kids are buying these off other people. I heard of another case this week where a kid bought an e-cigarette from somebody else that had been filled with an alcohol too, which you really don't want to burn and inhale, so to speak. So I think they're going to find that it's multifactorial, that there's some people at increased risk, but there's going to be a population of them that are using other things to inhale that aren't meant to be inhaled, and that we might have some of these off-brand type pods and juice out there that might be contaminated. Again, a lot of this juice comes from China and other places that's totally unregulated. So hopefully it helps a little bit, but we don't have answers. That's part of the frustration.
I can see that. Okay, someone's asking, how can Juuls advertise on radio and TV?
Well, because there's some loopholes on this and the fact that they're not cigarettes from that standpoint. So they want it both ways. They initially came on the market saying they were a cessation product, but then they were going to be lumped into that category, and they said, no, we're not. And now that the FDA is trying to regulate them, they want it both ways. But your question is a good one. I don't understand. I saw that commercial last night, and I kind of thought, wait a minute, what is going on here? How could Juul have a commercial on TV? But I guess there's some loophole that's allowing them to have this, because it was on TV, and my wife and I both look at each other going, what was that? And played it over again. I'm going, wow, that is amazing. So I don't know how they're getting through, but that's scary.
Oh, it certainly is. And the next question kind of leads into this. The question is, how do we get the FDA on this, and how do we raise the level of concern?
Well, both the American Lung Association and the Academy of Pediatrics have sued the FDA because they're just taking too much time, and their timeline, they keep pushing back. And, it's scary. As much as I might have disagreed with some of the administrators in the current president's cabinet, so to speak, Dr. Gottlieb was FDA commissioner when he really took on basically the e-cigarette industry and was really starting to hold them to task. And when he basically announced his resignation, the tobacco stock went up 12%. So that tells you something right there, that they don't want this type of administrative rule. And so, it's being done more through pressure. And I think we just need to keep pressure on our congressional delegates, our senators, and our congressmen. We need tobacco 20 to be passed, was talked about for a while as a federal, and we're still moving forward with it by county and state by state. But that's one area we can get at and raise the age at which these youth can buy it, because any barriers we can put in their way does show from past experience to decrease use.
Well, I'd just like to back up when Dr. Mahr says certainly think about contacting your representatives. We certainly see when people do talk to their elected officials, things do happen. So please consider that as something you might want to mobilize a little bit and do. Our next question is there an increase in popcorn lung associated with e-cigarettes?
Well, they haven't seen it to that same degree that they saw in those factory workers, but it's what's risky. And I wonder that. There was a CT scan shown on one of the station or one of the news reports that I saw that really looked like bronchiolitis obliterans. Now that's the problem. None of these 150 cases, none of them are being shared widely with medical people. So none of us know what's really going on. But I think that might be one of what we're seeing, is that, maybe some of these other chemicals that we know can cause bad problems are causing bad problems, because they're talking about some of these patients, and yeah, I should say youth, because that's what they generally are, having scarring that might be permanent. Well, that would sound exactly like bronchiolitis obliterans to me.
Okay. Okay, a next question is there anyone out there researching clinical findings associated with the respiratory failure that's being seen with vaping, and how fast can that get published?
Well, yeah, that's the million-dollar question. I mean, I don't know if anybody was researching. Now we're going to see a nidus of these in certain areas, like the Milwaukee area had 12 reported ones recently and another 12 under investigation. You know, are people pulling them all together? We do have the American Lung Association has the Airways Clinical Research Network that might be able to be mobilized in about 7 to 9 different cities. But I think it all depends on where they're located and how they get reported, and then who does the follow-up. So, I mean, it's a great question. It would be nice to know that we have all those workings in place, but the pessimist in me thinks that's not going to happen as easily as we think.
It would make too much sense, wouldn't it? Okay, the next question is this something that's being incorporated into training for allergy and asthma physicians, so to try to address with their patients?
Yeah, I mean, I gave a talk very similar to this at the Alabama Allergy Society recently, and as much as I can, we're talking about it. We're doing programming for this at our American College of Allergy, Asthma and Immunology meeting in Houston in November. And so I think it's something that it's, again, being looked at same way as it is through pediatrics for pediatric trainees. So, I mean, the word is getting out there a little bit more.
Sounds good. Oh, do you have a suggestion? This is a health teacher and wants to know if you have a suggestion for a reference for a video that you could show to high school students to discourage them from ever trying vaping.
Well, you know, I'd go back to these de novo files. I'll show them here on the screen again. I think these are amazing, and they really get youth. I've used these with some talks I've given to youth, and they find them, they're really geared towards youth. And so, you know, they hit about addiction. They talk about what happens to your brain, the light switch that goes on, and there's the specific one on e-cigarettes. So I would consider looking up these de novo files and basically look at using those in your classroom.
Okay. Is there an age limit to buy vaping equipment, or the liquid itself, or the e-cigarettes?
Yeah, most states it's still 18, but the ones that have passed the tobacco 21 that have included e-cigarettes is 21. The downside to this, and that would be the pessimist in me coming through, is that all of them are available on the internet, and you can buy them, and all you have to do is attest that you're, you know, greater than 18 or greater than 21. There's no other way you really prove it, and so that's the big loophole there. But you know, we can do what we can do.
Right, and keep raising awareness. Someone's asking, where does one purchase the THC pods, especially teens? How readily available is it? Well, you just mentioned online. You know, if someone was going to, what kind of a store would they go to buy this at?
Well, I mean, no, look at the states. I mean, last week in cystic fibrosis, I do CF care, and CF care, I was talking to one of my CF patients, and he was using e-cigarettes now, and he was basically using them with THC, and he felt that was better than smoking just marijuana. I said, where are you getting these? And he goes, well, you can get them from Colorado. And he said, if you're stupid enough to have it mailed to yourself, you can get them. He goes, I'm not that stupid, so a friend gets them delivered to his house. Kind of going, wow. Okay. So, I mean, again, the states where it's legal, it's legal.
Wow. Okay, here's a great question. Are there risks associated with the secondhand smoke of these devices in relation to how nut flavors might affect nut allergies?
I've not seen anything on that. I would doubt it would be, I don't think that, I mean, what you really need to have is the protein in the nuts. And so I would really find that difficult that patients would have truly an IgE-mediated allergic reaction. It's a good question. But I've not read anything. I've not seen anything. I would find it hard. I think you might find somebody who's nut allergic or strawberry allergic or whatever. If they smell this, they might get themselves ill from that effect, but it may not be, just like the smell of certain products for people will make them sick when they're allergic, but they're really not having an allergic reaction.
Okay, thank you. Okay, someone's asking, can you
Mm-hmm.
say a bit more about how vaping might affect kids with asthma versus smoking conventional cigarettes? She said, you said vaping might be safer, but there are unique risks associated with vaping, ultrafine particles, for instance, that could be even worse for kids with asthma.
Yeah, because of just the fact that they're also bronchodilating at times with their inhalers, and depending, this is again all dependent on what device they're using, what juice they're using, all of that. That's why there's so many unknowns here. You could speculate that there might be some kids who are going to be at greater risk because just the draw on the e-cigarette, the fact they're going to inhale more than they would with a cigarette because the cigarette is harsher and burns a little bit more. I hope this makes sense what I'm saying, but that's the theoretical risk. Now we do know that in some epidemiologic studies that asthmatics are smoking more because they think that way. And so that's the slippery slope, is that they're going to, more readily start, because they're kids and because youth are like that, they will have some problems, and they'll think that, okay, wait a minute, the rest of my friends are doing this, I'm going to try it, but instead of smoking, I'm going to use e-cigarettes because it's safer. Well, that's not an argument. Not starting at all is safer. So, and there's not a lot of data out there to answer them directly. There's beginning to be some studies, but not a lot. That's why I decided not to go delve in deep into the data, because there's just not a lot out there yet.
Well, we certainly know that we're going to need that data in the days to come. Someone here
Yep.
who works in a school health office is asking, would you see any specific symptoms that would, in a student, that might tip the school nurse off to thinking that they might have the popcorn lung issues rather than simply, your typical respiratory type distress?
Oh, that's a good question. I mean, I would, there's nothing specific except more of a chronic cough, whereas a typical cold might be a cough that, starts off, gets a little worse, has a runny nose, a little fever and all that. Whereas this, if you've damaged your lungs like this, you're going to be, have more coughing spasms. You may be coughing up more discolored things. They might have a little blood tinge to it at times, but it's more going to be a chronic cough, more chronic productive cough.
Okay.
And I'm hoping you're not going to see it.
Well, definitely. Someone else is asking, what can they do in their school district to educate students that are doing this?
Well, that's the tough one, but I think, getting at them, peer-to-peer education works. Maybe connecting with your American Lung Association at your state level, and then find out is there something available in your local area. Teens Against Tobacco Use, tattoo. There's a variety of other areas that, teens might be engaged in this. I think we're going to see hopefully some more mobilization and more peer-to-peer education coming.
Sounds good. Someone actually wrote in that the cdc.gov/e-cigarettes resources are for educators, parents, coaches, and those who work with youth. And there's a 45-minute PowerPoint presentation also available.
So there's a lot of resources out there. I think you just need to actually, think about them and go hunting, and that's another good source.
Absolutely. Well, I would like to thank you so much for this fabulous information, Dr. Mahr, and I would like to thank everybody on the line for listening today. But again, thank you so much, Dr. Mahr. This is something we just all need to be thinking about. Okay,
thank you.
Please join us next month for our September webinar when we welcome Dr. Julie Wang, who's going to present the next steps in peanut allergy. This webinar will air on Monday, September 23rd at 2 p.m. Eastern. We're changing our times around to try to meet people's schedules the best we can. You can register for this webinar on our website at allergyasthmanetwork.org. Look for education in the horizontal navigation bar near the top of the page and scroll to webinars. This is also where you can view our archived webinars. At this time, please download the handout from your control panel, the certificate. If you have any difficulties, you will receive a follow-up email, and you can certainly email me and I'll help you out. You can also visit our website for quality guidelines-based resources on allergy and asthma, and you will receive a follow-up email that will discuss how to obtain CE. We also want to make sure that you get great information on allergies and asthma from the American College of Allergy, Asthma and Immunology at allergyandasthmarelief.org. Thank you again for joining us, and we look forward to having you register to be with us next time on Advances in Allergy and Asthma. This is Sally Schessler for the staff at Allergy and Asthma Network. We hope you have a great and healthy day as we work to breathe better together.